So here you are watching drug-induced sleep endoscopy with DISE monitoring in a 56-year-old male with history of mouth breathing, snoring and choking. His body mass index is 30, so he is a little obese, overweight, and he's got a deviated septum on the right side. As you can see, there's turbinate hypertrophy on the left, and his principal complaint is that he cannot sleep on the on the left side. He can only sleep on the right side, and then also he chokes and snores a lot. His sleep study shows apnea-hypopnea index of 23, most of which are obstructive apneas. And as we go inside, there's no adenoid. The salpingopharyngeal folds are also not really enlarged. They are grade 0 by Ekbas classification. And as we go down, we can see a complete collapse of the soft palate. You can see the large tonsils coming together, but it's both AP as well as lateral collapse. You can see this is the AP collapse, and both AP as well as lateral. So large tonsils completely coming closer and blocking the full airway, but there's no tongue base enlargement. Just waiting for the apnea to. Now you see the base is 58, saturation is 83, so this is definitely. You can see the large tonsils here, covered by the the palatopharyngeal folds. So even at the base of 75 now, there is no tongue base collapse. It's majorly a soft palate collapse, and which is both AP as well as lateral. But good part, it's majority of it is in the lower part. That's the velopharyngeal tube that we talk about, long velopharyngeal tube. So his palatal length is quite a bit. His tonsils are large, so he'll require a proper uvulopalatopharyngoplasty. The length of the palate has to be reduced, along with suspension bridge for both AP as well as lateral collapse. Nothing is required for the tongue base. So along with that, he requires turbinoplasty on the left side at least, and septoplasty to bring the septum in the midline. On the CT scan, there's nothing in the sinuses, though he's got symptoms of allergy. So he'll require a nasal spray after that. But you can see the elevated septum on the right, which is completely blocking the right side. That is the cause by which he is unable to sleep on the left hand side. We'll correct that septoplasty, turbinoplasty, modified uvulopalatopharyngoplasty with suspension. Thank you for watching.